Thank you so much for your interest in our program. We are so excited to tell you about some of the award-winning programs we have available here at Levine Children's Hospital and that are part of our residency program. I am the co-director of the Center for Improving Pediatric Excellence, otherwise known as CAPE, and we head up the quality division in pediatrics. Many of you have had some experience with quality improvement either in medical school or elsewhere, but this will be an opportunity for you to have an in-depth longitudinal experience unlike no other in the country. Our longitudinal quality improvement program has been award-winning. We won several national awards for innovation with this program. The program starts you off as an intern using a personal improvement project to teach you the methodology and how to embark upon the hard work that change is. The personal improvement project is a 12-week project where the intern takes something that is near and dear to their heart, like exercising, eating more fruits and vegetables, playing the piano more, are all examples of a personal improvement project that our residents have undertaken. Working with their QI coach, they work on working towards a goal and what are some changes that they can make to get them closer to their goal. During this process, you learn quality improvement methodology, techniques, and how to do a plan, do, study cycle. Next, the residents also do present that work to each other and some of the faculty, and we've had some amazing projects presented of residents really thinking in a thoughtful, innovative way to change. The next thing during your internship is your reflective practice project. And what that does is it really takes a look at your own practice in clinic. Something in your continuity clinic that you either feel you should be doing or you would like to incorporate it into your well child visits or your sick child visits. Often people choose things like injury prevention, gun control, something that might be perhaps very near and dear to their heart. Maternal depression is also people have looked at to develop scripts for themselves and reminders to incorporate it more into their well child work. So after those two have been undertaken, you really do have the basis of what you need to become part of a quality improvement project. One of the things that residents come back to our project and really resonates is they don't really realize when they're undertaking this how important it is and how it is going to impact the rest of their career. Residents get assigned to either a project if they're having difficulty picking them, but the majority of our residents, through many different venues, we have a Shark Tank where the attendees get up and present their patients, their projects rather, and we also have other projects that people might be interested in that they get on a project. The last resort is really to assign someone a project. A few people who are very brave do undertake a quality improvement project of their very own, starting from the very beginning with quite a new project. We've had several residents be very successful with that, and their work has been replicated. One in particular, that is an ED partner screening project, really has been replicated throughout our system. So it can be very rewarding, but requires a lot of work. Once a resident is on a project, they usually take a piece of a project that interests them or something they feel passionate about and start working towards making that part of the project better. Often, because the residents rotate from month to month, with some months being more difficult and more clinically stressful than others, they may work on their QI project intermittently over the year. Standing beside them is the QI coach, helping them arrange, set up meetings, and also giving them ideas about what changes may work and what changes have been tried in the past and what other things they could perhaps model their project around. The residents often, during second year, get together and talk about their projects in some structured setting to get feedback on how things are going. If they meet a roadblock, they have an opportunity to talk to QI mentors and their peers to figure out how to remove that roadblock and move on. The third year culminates in them being a leadership person on the project, leading the QI project in their particular piece, and having a scholarly presentation. Usually that can be a national scholarly presentation, or it can be a local presentation of their QI work. Many of our residents who have really embraced our QI projects in both the specialty world and the primary care world have gone on to be leaders in QI in their either individual practices and gotten protected time, or QI leaders within their fellowship program. We have an equal distribution of projects in inpatient and outpatient, some that are interdisciplinary, involving emergency department, involving family practice, even involving surgery and radiology. All of that is welcome and embraced. In QI, we feel all teach, all learn. I know you're probably wondering how, during a busy resident schedule, that you can accomplish this. With our longitudinal program, we have a tremendous amount of support leading you, helping you, assisting you, and following you in some cases, because sometimes the resident is really the content expert. We have a QI coach assigned to each resident, as well as a data analyst. In addition, you will have the services of our program manager, as well as the support of all the coaches. There are 2 other faculty members who work in CAPE, myself and Dr. Laura Noonan, and we are available for consultation during any point of your project. In addition, on each project, you will have a faculty lead who will help you design tests of change for your project, give you insights into why it's so important. Very few times you can look at something you do on a daily basis and say, I am really helping and improving the lives of children. 600 children every single day are helped by our quality improvement projects performed by our residents. That's something we are extremely proud of.